The UK's mutated COVID virus supposedly spreads much faster than the already supposedly very contagious so-called COVID-19. Interesting. And the CDC seems to indicate that the World Health Organization and the mainstream media are not being exactly accurate on this death toll of this COVID thing. This is the end of Hour 2 of the Jesse Lee Peterson Show, Thursday, December 24th, 2020. Merry Christmas, everybody. It's Christmas Eve. Stay tuned for Hour 3 with Jesse Lee. After JLP, catch the Hake Report, thehakereport.com/show. This mutated virus, the CCP virus, Chinese Communist Party virus, variant in the UK spreads over 50% faster, according to a study, reports the Epoch Times. The non-peer-reviewed study by the London School of Hygiene and Tropical Medicine used mathematical modeling to project the spread of the new strain that's in southeast England right now. We estimate the transmission rate of this variant is 50 to 74% higher than existing variants, said one study author, Dr. Nick Davies, but no clear evidence that it leads to higher rates of hospitalization or death compared to its the transmission. But it's likely to ultimately push up the number of cases and drive hospitalizations and deaths beyond the levels of 2020. So, I mean, just expect it. Without effective control policies, rapid surges are predicted, and the burden of the first 6 months of 2021 may be greater than what we saw in 2020, said Davies on Twitter. Oh gosh, sounds like he's pushing for more lockdowns. What a ridiculous person. There is another variant, yet another, in South Africa. And so the UK has banned flights from there. Great, right? And they're pushing more vaccines. 24 million people in the southeast of England will be effectively in lockdown, with all but essential shops shut down, including gyms, hairdressers, and pubs, I gather. What a mess. And the mainstream media and the evil UN's corrupt WHO, World Health Organization, lie. And a CDC report shows that they're misinterpreting the COVID-19 data. Maybe unintentionally honest, CDC, because the CDC, the Centers for Disease Control and Prevention, and the HHS, the far-left government, U.S. government agency, is very liberal. They're on the COVID-19 mortality rates, though, show that the organization is not clearly differentiating between coronavirus-caused deaths and coronavirus-related deaths. The CDC claims that it abides by the World Health Organization's guidelines when reporting causes of death, namely by using what's called the International Statistical Classification of Diseases and Related Health Problems, 10th edition or something like that, ICD-10. The WHO created two classifications for coronavirus deaths to account for the number of cases where a clear cause of death is not able to be determined. One is meant to be used in cases where a lab was able to confirm the virus was the true cause of the death, whereas the other was to account for all the other cases where COVID-19 was just part of the diagnosis. The American Academy of Family Physicians pointed out that the CDC only adopted one category. That leaves room for interpretation about when to use the code, which leaves physicians without clear guidance. CDC's Vital Statistics Reporting Guidance Report does not provide much clarity, including defining the underlying cause of death, either the disease or injury which initiated the train of morbid events leading directly to the death, or the circumstances of the accident or violence which produced the fatal injury. Isn't that interesting? Some coroners, however, are finding the broad description difficult to manage and report that they are being expected to classify any death by any cause as coronavirus related if the patient had or was presumed to have the virus at any point before their death. That's what they're saying. So, reportedly, there are actually gunshot wounds, stated Brenda Bach, a coroner in Grand County, Colorado. The people had tested earlier for the month for COVID, and because they did have COVID, our state health department is listing them as COVID deaths. What? Is that true? From February to the first 3 weeks of December, there were 411,000 plus deaths due to pneumonia, influenza, or coronavirus. It's ridiculous. I'm James Hake. Now